Well, for many, multiple sclerosis isn't just a diagnosis. It's a life sentence, a disease that bit by bit robs you of your ability to move and feel. Earlier on the National, health reporter Kelly Crow reported on Canadians who want a controversial treatment made available here. Now, Kelly has a closer look at that surgery, and we meet someone who wasn't willing to wait to have it here.
For 10 years since being diagnosed with MS, I have lived my life like a prisoner on death row. I could see the end of the line and it wasn't good. But years have passed and there's been no hope or promise of anything good on my MS horizon.
For Ginger McQueen, multiple sclerosis is slowly ruining her life. At 45, her legs are weak and unsteady. Her disease is getting worse despite the MS drugs she takes. What she sees in her future is terrifying. Not being able to walk, becoming chair-ridden, perhaps bedridden. She's even investigated assisted suicide.
If I get to that point where my quality of life is bleak, that's my out.
So she has decided to take a chance on a controversial experimental surgery that she can't get in Canada.
If your health is where you feel you can wait a couple years, who knows? I mean, hopefully we'll have this surgery available in our own countries. But some of us, we feel our time is running out.
Ginger is a well-known MS blogger. She's promised to keep her readers posted as she journeys to a small Polish city in search of hope.
I will do my best to post when I'm in Poland to keep everyone updated. See you virtually in Poland.
Ginger and her husband Steve have allowed us to bring our camera along and record it all, no matter what happens. Are you excited? Are you nervous?
Well, I mean, part of me, you know, is excited, part of me is nervous, part of me is skeptical. So, yeah, kind of combination of everything.
Katowice, Poland is a small city well off the tourist radar. It's an unlikely place to seek medical treatment. But it's one of only a handful of places in the world where doctors are daring to experiment on MS patients, defying accepted practice. So MS patients like Ginger are flocking here to have their neck veins surgically opened, a procedure unheard of until a few months ago. They're calling the condition CCSVI, and a small study has suggested the blocked veins are more common in people with MS, but there is no proof. Still, Polish surgeons have turned that theory into a booming business. 5 operations a day, and they're booked solid until later next year. The whole package cost Ginger $10,000.
My husband and I arrived yesterday evening in Katowice and were met by our driver Maciek from Euromedic. So far, everyone we have met here in Katowice has been exceptionally friendly and helpful.
So you just had the surgery. How are you feeling?
I'm doing great.
Down in the hotel lobby, Ginger meets one of her online fans. DG Phelps from California has just had the surgery. She says she's already noticed a difference.
Well, I couldn't normally stand like this. I'd have to have the crutches for the balance. And when I went into the cathedral in Krakow, I was looking up at the vaulted ceilings, and all of a sudden I realized I'm looking up at the vaulted ceilings, because normally I would have to push my head back and I would have to hold my head and support it. I wouldn't be able to do it myself. So see, I can look up.
At this point, Ginger isn't sure she has CCSVI. This morning, the driver is taking her for an MRI. Sometimes doctors can see the blocked veins that way, but it can be difficult to spot. Both Ginger and Steve are hoping they find a blockage. That way, there's something to fix.
I think there's been enough anecdotal evidence at this point to say that there is something to this technique. And the risk involved in doing it, I think, is minimal for the potential benefit. There are no drugs out there that will stop MS. At the most, they can claim that it might slow it down somewhat.
Ginger knows she's taking a chance being here. The surgery to unblock neck veins is untested, and sometimes doctors must insert a permanent metal stent to keep the veins open. Ginger's fear is that the stents can migrate. Already, one MS patient had to have emergency surgery after a stent moved to his heart.
The last few days I've been obsessed with stents as I'm worried that I may need one or two. My problem is that the stents being used are not designed for jugular vein use, and that worries me.
It's the night before the surgery. Back at the hotel, Ginger tries to relax after coming so far and now being so close. She realizes for the first time in a long time she's allowed herself to hope.
Having hope these last few months has almost been like an addictive drug because I haven't allowed myself hope. Tomorrow could possibly be the beginning of a new life.
We ready?
Just took a bunch of pills on an empty stomach and I haven't had coffee, so...
Oh, so please lie down. Yeah? I think that this fluctuation on the left side are secondary to a problem on the right.
In MS circles, this man is famous. He's Dr. Marian Simka, a pioneer in diagnosing blocked veins using Doppler ultrasound. So the fact that it goes below the line here tells you that it's abnormal.
Yes. It shows that there is a problem here.
The final word will come on the operating table.
Thank you.
Can I leave underwear?
Wszystko zdjąć.
No underwear.
Nic nie może być.
So what seems to be happening?
I think she said echocardiogram, if I'm not mistaken.